Ever wonder what goes on in those crucial moments when paramedics are dealing with someone who just can't breathe?
Oh, it's intense, like life or death intense.
Yeah, no kidding.
Yeah.
So we're taking a deep dive today into the world of respiratory failure, and specifically how paramedics are trained to handle it. We're going straight to the source. Excerpts from their actual standards document.
Straight for the front lines, huh?
Exactly. And you might be surprised by how much goes into it. Like, what's the first thing they have to do when they arrive on the scene?
Well, the standard lays out 4 absolute must-dos, and the first one's pretty obvious. Ventilate. You got to get air into those lungs, and they follow some seriously strict guidelines from the Heart and Stroke Foundation of Canada.
So it's not just like blowing in their mouth. There's a whole science to it.
Oh, absolutely. And that's where the second action comes in, making sure it's working. They're looking for that chest rise and fall, making sure air's going in and out. They also listen to the lungs, making sure it's reaching all the right places.
So they're not just pumping air, they're making sure it's actually doing something.
Exactly. Then comes number 3, minimize interruptions. Consistent airflow is critical, especially when someone's totally reliant on that external support to breathe.
Makes sense. Keep that oxygen flowing steady. So what's the last thing?
They got to keep supporting that breathing until the person can do it on their own again. It's like bridging the gap until their body kicks back in.
So you know how the standard stresses providing just enough support to see the chest rise? Why is that so important?
You know, that's a great question. It's all about this delicate balance, right? You want to help them breathe, but too much air or too much pressure, that can actually backfire.
Seriously, too much air can be a bad thing.
Yeah, it's like, think of inflating a balloon. Too much air and boom, it bursts. The lungs are kind of similar. Too much pressure can cause something called a pneumothorax, where air leaks into the space around the lung, or even barotrauma, where the pressure actually damages the lung tissue.
Whoa, I never thought about that. Just shows how much skill it takes to be a paramedic.
For sure. And that's where the ETCO2 monitoring comes in. You know, the standard mentions this target range of 35 to 45 millimilli HD. What's that all about?
Yeah, I was wondering about that. What even is ETCO2?
So ETCO2, end-tidal carbon dioxide, it's like a measure of how much carbon dioxide is in the air someone breathes out. You know, CO2 is a waste product our bodies make, and the lungs get rid of it when we exhale.
Okay, so if the reading's within that range, that's good.
Yeah, generally it means things are working, ventilation's effective, the lungs are doing their job, clearing out that CO2.
But then there's that exception, right, for people with COPD or asthma.
Right. Now, this is where it gets really interesting. See, people with those conditions, they often have higher CO2 levels to begin with. Their lungs don't clear it out as efficiently, but their bodies have gotten used to it, adapted over time.
So their normal is different from someone who doesn't have those conditions.
Exactly. And if you try to force their CO2 levels down too quickly, it can mess up their system. Their body's like, whoa, what's going on here?
So what happens then? What kind of problems can that cause?
Well, it can throw off their body's acid-base balance, you know, like the pH level. And that can lead to a whole cascade of complications. Instead of aiming for that 35 to 45, the guidelines recommend a slightly higher range, 50 to 60, for those folks.
So it's not a one-size-fits-all approach. You have to take into account each person's individual situation.
Precisely. And it really highlights how complex this stuff is. You're balancing these standardized procedures with, like, the need to adapt to the person right in front of you. It's pretty amazing when you think about it.
Totally. It's a lot more than just breathing, isn't it?
Yep.
It makes you appreciate how much knowledge and skill it takes to be a paramedic.
Absolutely. And it makes you think, you know, in that moment, with all the pressure and limited information, how do they make those split-second decisions? How do they know when to stick to the guidelines and when to trust their gut? It's a tough job.
Yeah. You know, we often think of emergency medicine as this race against the clock, but it's really about understanding the individual, isn't it? Blending that textbook knowledge with, like, a real awareness of the human being in front of you. That's pretty powerful.
Powerful's a good word for it. Life-saving, too.
Yeah. Well said. Ever wonder what's really going on when someone's gasping for air? Like, it's more than just needing to catch your breath.
Right.
Today, we're doing a deep dive into shortness of breath emergencies.
Oh, wow.
And get this, we're using the actual paramedic guidelines for these situations.
Interesting.
We're going to uncover all the clues paramedics use to solve this medical mystery. It's like Sherlock Holmes, but with stethoscopes instead of a magnifying glass.
I like it.
So let's talk about the seriousness of this.
Yeah.
We're talking about breathing problems that can threaten
Yeah.
your life, limbs, or even like basic bodily functions.
Right. And it's not always obvious what's causing it. You really have to think about
Right.
both the respiratory system, the lungs,
Mm.
and the cardiovascular system. So your heart and all the blood vessels.
So it's a two-pronged approach. It could be either one or even both.
Yeah.
The guidelines actually highlight that. They say to always consider both.
It's like a detective show. You have to kind of rule out suspects one by one, to figure out what's really going on.
And some of these suspects are pretty scary. I mean, we're talking
Oh, yeah.
like a collapsed lung,
And pneumothorax, yeah.
pneumothorax, yeah.
Uh.
Or even inhaling toxic fumes.
Yeah, those are some of the more dramatic causes.
I mean, just thinking about like a lung deflating,
Oh, yeah.
it's scary.
It can be very serious.
And we can't forget about the toxic fumes either. Like that's
Yeah.
a whole other level of scary. But then you mentioned something earlier about a stroke.
Yeah.
How does that even relate to breathing problems?
Well, a stroke basically disrupts brain function.
Right.
And guess what? The brain controls our breathing.
Oh, that's right.
So even if the lungs themselves are perfectly fine, a stroke can throw off the entire respiratory system.
So you're saying that like even if someone seems like they're just hyperventilating,
Yeah,
it could be something much more serious going on.
exactly. So paramedics are trained to look beyond the obvious, consider the underlying causes. And they might suspect something like metabolic acidosis, for instance.
Metabolic acidosis. I'm not sure I'm familiar with that one.
So think of it this way. Our bodies need a certain balance of acids and bases to function properly.
Okay.
And metabolic acidosis is when that balance gets tipped towards too much acid.
I see.
And this can happen for a variety of reasons. Kidney failure, severe dehydration, and it can disrupt breathing by affecting the lungs and how the brain regulates respiration.
So it sounds like if someone is struggling to breathe, the paramedics have this like huge mental checklist
Oh, yeah.
that they're going through trying to figure out what's going on.
Absolutely. They're looking for clues from head to toe. They'll check the chest, looking for signs of lung issues.
Yeah, like we talked about in our deep dive on chest pain.
Exactly. Then they'll examine the head and neck, looking for things like cyanosis.
Cyanosis.
Yeah, that's basically a bluish discoloration of the skin, especially around the lips and fingertips. And that can be a sign of low oxygen in the blood.
Right. Cyanosis. I've heard that term before. And that makes sense. If your blood's not getting enough oxygen,
Yeah.
it would show up as like a change in skin color. But the assessment doesn't stop there. They're checking other things too.
Yeah, they also look for things like swollen ankles
Okay.
or edema, which can be a sign of heart problems. And they might even examine the neck veins looking for jugular vein distension.
Jugular vein distension. What's that?
So that basically means the veins are bulging,
Okay.
which can indicate heart failure where the heart's not pumping blood effectively.
So if you see like jugular vein distension along with shortness of breath,
Right.
that's a pretty big red flag that something's wrong with the heart.
Exactly. It's all about connecting the dots. Each detail, from skin color to ankle swelling, helps paramedics build a picture of what's causing the shortness of breath.
And it's not just about physical signs either, right?
Yeah.
They're asking questions about the person's medical history.
Oh, yeah, absolutely.
Like if someone uses oxygen at home, for instance.
Yeah, knowing if someone relies on supplemental oxygen
Right.
and if they've noticed any changes in how much they need, that's crucial.
Right.
It could indicate that their underlying condition is worsening.
So once the paramedics have gathered all these clues, what happens next?
Well, beyond providing immediate treatment,
Yeah.
they also want to make the patient as comfortable as possible.
Okay.
And positioning can play a big role in this.
Right.
Often sitting the person upright can make breathing easier.
Yeah, because if you're lying flat, it seems like it would be harder for your lungs to expand fully.
Exactly. And it all ties back to ensuring the patient is getting enough oxygen. And there's actually a specific standard called the respiratory failure standard that paramedics use to assess and manage breathing difficulties.
That sounds like a whole other deep dive in itself.
Oh, for sure.
Maybe we'll have to tackle that another time. But
Sure.
I guess for now, the key takeaway is that shortness of breath is a complex symptom with a whole range of potential causes.
Exactly. It's not always just a simple case of being out of breath. And understanding that there's a whole investigative process behind it
Right.
can help people better advocate for themselves or their loved ones experiencing shortness of breath.
So it's like being your own health detective.
In a way, yeah. Paying attention to those details, asking the right questions, it can make all the difference.
Great advice. And remember, if you're ever in doubt, don't hesitate to seek medical attention. Stay curious and stay informed.
Absolutely.
All right, so today we're going deep on something that, you know, might not be on your mind every day, but it's super important when it comes to emergencies.
Oh, yeah.
Spinal motion restriction, SMR for
Yeah.
short.
Yeah.
Basically, how paramedics decide, what to do when someone might have a spinal injury, and it's a lot more complicated than it seems.
You're telling me it's a whole process of figuring things out right there on the scene. And it's really fascinating stuff, even if you're not, a paramedic yourself.
Right, absolutely. So let's say you're at like a car accident, right?
Okay.
There's a patient and you're the paramedic.
Right.
Got to figure out, is their spine okay? I mean, you can't just like x-ray them right there on the street, can you?
No x-ray machine in the ambulance, unfortunately.
So how do you even start?
Well, that's where the idea of mechanism of injury comes in.
Mechanism of injury.
Yeah, we look at like how the injury happened to figure out if the spine could be involved.
So it's not just about them saying, oh, my back hurts.
No, not at all. Like I had this call once, construction worker fell off a ladder, maybe 10 feet, landed right on his feet, and he was complaining about his ankle, but said nothing about his back.
So you'd think ankle, no problem.
Right, everyone thought that.
Yeah.
But something about how he landed just, it didn't sit right with me, the force going up his legs.
Oh, wow.
So we immobilized his spine just in case. Turned out he had a compression fracture in his lower back. He didn't even feel it at first because of the ankle.
Wow, that's crazy. So mechanism of injury is like detective work in a way.
It really is, yeah.
So you're at the scene, you've thought about the mechanism of injury, what's next? What are you actually looking for?
So then we get into the risk criteria.
Yeah.
There are specific things we look for, and it's way more than just, visible injuries.
So what are some of those red flags? Give us the rundown.
Well, obviously they're saying my neck hurts, my back hurts. That's a big one. But we're also checking for things like, tenderness when we touch the spine, or any neurological signs like tingling, numbness, weakness in the arms or legs.
So even if it's subtle, could still be serious.
Oh, yeah. And then you have to think about their mental state,
Mhm.
or are they confused,
Right, yeah.
disoriented, not responding normally? Could be a head injury, which might also involve the spine.
Like putting together a puzzle,
Yeah.
all these clues.
Exactly. And then there's intoxication.
Right.
If they're under the influence of something, they might not feel the pain as much or be able to, tell us what's wrong.
Right, that makes things a lot more difficult.
It really does. And, there's this idea that paramedics can, clear the spine in the field. If you don't
Yeah.
get strapped to a board, you're fine.
Yeah, you see that all the time in movies.
Yeah. But the truth is, we can't really rule out a spinal injury without, a full medical evaluation with imaging and everything.
So SMR is more about buying time, minimizing risk until a doctor can take over.
Exactly. It's about protecting the spine from more injury, not making a diagnosis right there.
Okay, that makes a lot of sense. So let's talk tools of the trade. The spinal boards.
Oh, yeah.
I mean, we've all seen them, movies, TV shows, very dramatic.
Oh, yeah, the spinal boards. Very dramatic. But in real life, their role is kind of changing.
Really? Tell me more about that.
Well, for a long time, it was like spinal board automatic anytime you thought maybe a spinal injury.
Right.
But we're realizing that, yeah, they're great for getting people out of, messed up situations like a car wreck.
Right.
But keeping someone strapped to a hard board for a long time might not be the best for them in the long run.
So it's not just like strap them down and we're good.
No, not anymore. We're trying to get people off those boards as soon as it's safe.
Okay.
Research is showing that being immobilized for too long can actually cause problems. Discomfort, trouble breathing, and even makes some injuries worse.
So it's a balancing act. Protect the spine, but don't restrict them too much.
Exactly. And how long they're on the board depends on a lot of things. How bad we think the injury is, other injuries they might have, even like how long it'll take to get to the hospital.
I see. So if it's a quick trip to the hospital, maybe the board stays on.
Yeah, could be. But if it's a longer transport, then we want to get them off the board and onto a stretcher, something more comfortable, as soon as we can do it safely.
Makes sense. Now, what about those patients who are like agitated or uncooperative?
Ooh.
I mean, it's got to be hard enough to figure things out when someone's calm and can tell you what's wrong.
All right.
But what if they're fighting back, confused, maybe even delirious? What do you do?
Yeah, that is definitely one of the hardest things we deal with.
I bet.
Trying to immobilize someone who's combative or disoriented, all while knowing that one wrong move could make their spine worse, it's stressful.
I can imagine. Incredibly stressful for everyone.
Yeah, and in that situation, the number one thing is safety.
Of course.
Patient safety, our safety. If their behavior is dangerous, right, then we might have to restrain them first before we can even think about full SMR.
Wow, so it's about adapting to what's happening in that moment.
Yeah, exactly. No one-size-fits-all answer there. We're trained to assess the situation and respond in the best way we can.
So how do you even approach that kind of situation?
Well, we might try to talk them down first,
Okay.
calm them down, reassure them. Sometimes having family or friends there can help.
Makes sense.
Yeah. And sometimes we need to call for backup, police officers to help us manage the situation safely.
Wow.
Key thing is to stay calm ourselves, assess the risks, and do what's best for everyone.
I can only imagine how intense that is, and I'm guessing documentation is super important in those cases.
Oh, absolutely critical, especially when it's complicated like that. We write down everything, how they're acting, the problems we're facing, what decisions we made, and why we made them that way. If anyone has questions later, it's all right there.
Really paints a picture of how complex all this is. I think our listeners are starting to see that SMR is so much more than just a neck brace.
It really is. Yeah, it's always changing. We have to think critically, make decisions fast, and really understand the body, anatomy, physiology, even psychology.
It's fascinating. This deep dive has been eye-opening. We've learned that SMR is all about minimizing risk when we think someone might have a spinal injury.
Right.
It's about looking at how the injury happened, finding those clues, some obvious, some not, and making decisions based on what's going on in each specific situation.
Yeah.
And we talked about how the use of spinal boards is changing and how tough it is when patients are agitated.
It's been a really great conversation.
It has. And, it's important to remember, this is an area where there's a lot of research and debate happening.
Yeah.
What we know about SMR and how to do it best. It's always being updated as we learn more about spinal injuries and how to treat them.
That's a great point. Always more to learn.
Absolutely. So to our listeners, if this has you curious, keep learning. Maybe look into the latest research on SMR or even think about how these guidelines could apply to things you do.
Yeah, think about it. Understanding these ideas could help you make a difference in an emergency or even stop an injury from happening in the first place.
That's a great point.
Hmm.
Well, that brings us to the end of our deep dive into spinal motion restriction. I don't know about you, but I feel like I've learned a ton.
Yeah, me too. Always enjoy a good deep dive.
Me too. And to all our listeners, thanks for joining us on this journey. Stay curious, stay informed, and most importantly, stay safe out there.
Yeah, one thing to think about is, this debate going on about immobilizing people for too long.
Yeah.
And you said SMR is super important a lot of the time, but we're always trying to get better at finding that balance,
Right.
protecting the spine, but not restricting them too much.
So we're getting better at knowing who really needs SMR, but also realizing that too much of it can be bad.
Exactly. It's a tough balance, and that's why it's important for everyone, not just paramedics, to keep learning about the newest research and guidelines.
Yeah, knowledge is power, especially when it comes to our health. So listeners, if you're interested in this, don't stop here. Maybe check out some of that research on SMR or even think about, how these guidelines could apply to your own life.
Yeah, good point. Like understanding these ideas could help you, in an emergency or even prevent an injury.
That's a great point. Well, that wraps up our deep dive into the world of spinal motion restriction. I feel like I've learned a lot. What about you?
Definitely love a good deep dive.
Me too. And all our listeners out there, thanks for joining us on this journey. Stay curious, stay informed, and most importantly, stay safe. All right, so welcome back for another deep dive. And today we're going to be talking about something that could actually save your life. We're diving into soft tissue injuries.
Oh, nice.
And we're going to be looking specifically at a section from the Soft Tissue Injuries Standard Guidelines for Paramedics. Now, you might be thinking, well, I'm not training to be a paramedic. Why should I care?
Right.
But trust me, understanding these principles can be incredibly useful in everyday life. You might be surprised how much more there is to treating a cut than just slapping on a bandage.
Yeah, absolutely. What I find interesting is that these guidelines, they don't just focus on the immediate bleeding. They really emphasize the importance of considering, like, what might be going on underneath the surface.
Okay, so it's not just stopping the bleeding. We have to think about what we can't see. What kind of hidden damage are we talking about?
Well, think about it. What looks like a simple cut on the surface could actually involve damage to nerves, blood vessels, even bone.
Whoa, okay, so something that seems like really minor at first could be a lot more serious than we think. That's definitely something to keep in mind, even if we're, not medical professionals.
Exactly. And that kind of leads us to another critical point, hemorrhage control. The guidelines divide the body into 3 anatomical zones: extremities, junctions, and hollow spaces.
Okay.
And they actually break down how to manage bleeding based on where it is in the body, like based on your body's structure.
So let's start with the extremities. Arms and legs. I'm guessing those are the easiest to deal with since they're, well, out there.
You'd think so, right. But they present their own set of challenges. The guidelines recommend a stepwise approach, direct pressure first, then a tourniquet if necessary, and finally wound packing, kind of as a last resort.
And I see here they're very specific about that direct pressure. It has to be well aimed and right on the source of the bleeding.
Yeah, it's not just about pressing down hard. It's got to be targeted to be effective.
So we're thinking strategically, not just frantically trying to stop the bleeding. What about tourniquets? They seem like the go-to solution in movies and TV shows.
Yeah, tourniquets can be incredibly effective at stopping bleeding, but they're not without risks. That's why the guidelines are very specific about placement. They need to be on large muscle masses like the thigh or upper arm.
And once you put a tourniquet on, you shouldn't remove it in the field, even if the bleeding stops. That seems counterintuitive.
Yeah, it might seem that way, but removing a tourniquet too early could dislodge clots and restart the bleeding. Plus, you risk missing other injuries, focusing only on what's visible. The decision to remove a tourniquet is best left to medical professionals at the hospital.
Okay, so once it's on, it stays on. Duly noted. And I'm curious about those hemostatic dressings. I've heard about them, but I never really understood what makes them so special.
Hemostatic dressings, huh? They're basically designed to speed up clotting. They're preferred over standard gauze when packing certain types of wounds.
So like clotting accelerators. What about junctional areas? Like the head, neck, and groin. Those seem like they would be really tricky to deal with.
Oh, absolutely. Those areas have a lot of major blood vessels close to the surface, and the anatomy is much more complex. Using a tourniquet there could actually do more harm than good.
So no tourniquets in those areas. What's the best approach then?
Well, packing the wound tightly and maintaining that direct pressure, those are essential here. Imagine like you're trying to seal a leak in a high-pressure pipe. You need focused, consistent force to stop the flow.
That's a pretty vivid image. Now, what about hollow spaces like the skull, chest, and abdomen? I imagine those are the most difficult to handle.
Those are definitely unique when it comes to soft tissue injuries. And what might surprise you is that packing is actually a big no-no in these cases.
Wait, really? Less is more here. That goes against everything I thought I knew about first aid.
I know, right? But the reason is, packing those areas could increase pressure and lead to even more damage. Instead, the guidelines recommend applying gentle pressure with a flat palm.
Okay, that's definitely something I'm going to have to remember. It seems so counterintuitive.
Yeah, it does.
What are the reasons behind that approach?
Well, think about all the delicate organs in those cavities. Applying too much pressure or packing a wound could disrupt how they work and lead to complications.
So we're really aiming to stabilize things and minimize damage until we can get professional help. It's fascinating how much thought goes into something as simple as first aid.
It really is. And it's so important. Yeah, it really highlights the importance of understanding like the underlying anatomy and how that influences our first aid response.
It's like you need a map of the human body before you can even start thinking about treating injuries. We've covered the big three: extremities, junctions, and hollow spaces. But I'm seeing a whole section here on key techniques and tips. What else do we need to know?
These techniques are all about minimizing damage and setting the stage for optimal healing. They may seem small, but they can have a huge impact.
First up, cleaning the wound. Seems pretty basic, but is rinsing with water always the right move?
That's a great question. It really depends on the type of wound. For minor cuts and scrapes, rinsing with clean water is usually enough to get rid of debris and reduce the risk of infection.
So what kind of wounds would need like more specialized cleaning?
Think about a deep wound or one that's really contaminated with dirt or, other foreign material. In those cases, it's best to leave the cleaning to medical professionals. They have specialized tools and techniques to thoroughly irrigate and debride the wound, minimizing the risk of complications.
Makes sense. Better to be safe than sorry, especially when dealing with a serious injury. What about impaled objects? I remember always being told to never remove them. Is that still the golden rule?
Absolutely. Removing an impaled object yourself could cause more bleeding or damage to underlying structures. You never know how deep it goes or what it might be touching.
Okay, so hands off those impaled objects. What do you do then?
The key is to stabilize the object in place, using bulky dressings or bandages. This helps prevent any further movement and minimizes the risk of more damage during transport to the hospital.
Stabilize, don't remove. Got it. What about situations where there's protruding tissues, or even organs. That's kind of hard to even imagine.
Yeah, those are definitely more extreme cases. But the principles remain the same. Protect and preserve. You want to cover those exposed tissues with something that will keep them moist and prevent further damage.
So not just any old bandage will do.
Exactly. You need something non-adherent, meaning it won't stick to the delicate tissues. Moist, sterile dressings are ideal. But in a pinch, even plastic wrap can be used to create a protective barrier.
That's interesting. Plastic wrap is a first aid tool. Who knew?
It's all about improvisation sometimes. Another important point to remember is the importance of dressing digits individually.
Meaning fingers and toes. I'm guessing this is all about maintaining circulation and allowing for movement.
That's a big part of it.
Yeah.
But it also allows you to assess each digit for signs of compromised circulation or nerve damage. We call this monitoring neurovascular status.
So neurovascular status is basically checking to make sure everything is still working properly in terms of blood flow and nerve function. That makes a lot of sense, especially with something like a finger injury.
Precisely. You wouldn't want a tight bandage cutting off circulation to a fingertip, for example. And it's not just about the initial bandaging. The guidelines stress the importance of reassessing neurovascular status regularly, especially after dressing, bandaging, or splinting.
So basically, keep an eye on things and make sure nothing's getting worse. That's a lot to think about.
It really highlights the dynamic nature of first aid. It's not just a one-and-done process. You have to constantly observe and adjust your approach as needed.
Wow, I'm seeing first aid in a whole new light now. It's incredible how much detail and nuance goes into something that we often take for granted.
And that's just scratching the surface. First aid is a constantly evolving field, with new research and techniques all the time. This deep dive is really just a starting point to empower you with the basic knowledge and confidence to handle a wide range of situations.
Speaking of empowerment, what about the ethical considerations of using a tourniquet? It seems like such a powerful tool that could literally save a life, but also one that carries a lot of responsibility.
That's a very thoughtful point. Tourniquets are indeed powerful tools, but they also come with potential risks, like nerve damage or tissue loss if applied incorrectly or for too long.
So it's not a decision to be made lightly.
Exactly. Understanding the potential risks and benefits of a tourniquet is crucial, and that's why proper training is so important. In a life or death situation, you might be the only one with the knowledge to intervene effectively.
It's almost like weighing the potential harms against the potential benefits in that moment.
And that's why having a solid foundation in first aid principles can help you make informed decisions under pressure. It's not just about memorizing steps, it's about understanding the why behind those steps.
Okay, so for our listeners who are now fired up to learn more, what would you recommend as a next step? Where can people go to get that solid foundation in first aid?
I would highly recommend taking a basic first aid and CPR course. Organizations like the Red Cross and the American Heart Association offer excellent programs that cover a wide range of emergency situations.
It's great advice. Knowledge is power, especially when it comes to health and safety. And this deep dive is just the beginning. There's a whole world of first aid knowledge out there waiting to be explored. But before we wrap up, I have one final question that's been swirling in my mind.
I'm all ears.
We've talked about the technical aspects of using a tourniquet, but what about the emotional and psychological aspects? Imagine being in a situation where someone is severely injured and you're the only one who can help. The decision to use a tourniquet could literally mean the difference between life and death. What would you do? How do you even prepare yourself for that kind of responsibility?
Yeah, it really makes you think, doesn't it?
It does. It's not something you can just learn from a textbook,
Right.
It's about being in that moment and having to make a split-second decision.
Exactly. And that's where the importance of, training and preparation comes in. It's not just about knowing the steps, it's about having the confidence to act when it matters most.
So it's about more than just memorizing techniques. It's almost like developing a mindset, a willingness to be the helper, even when things are scary and uncertain.
Yeah, I think that's what's so inspiring about first aid. It's a testament to the human spirit, our capacity for courage and compassion.
It's about realizing we all have the potential to be heroes, even in the most everyday situations.
Absolutely. And those heroic moments, those times when we choose to act instead of just standing by, those can have a ripple effect. It goes way beyond just the immediate situation.
It's like a chain reaction of kindness and empowerment. So as we wrap up this deep dive, I want to leave our listeners with this. Don't just file this information away. Let it transform you. Embrace the power of first aid, not just as skills, but as a way of being in the world, a way of being present, compassionate, and ready to make a difference.
And remember, this is just the beginning. The world of first aid is huge and it's constantly changing. So keep learning, keep practicing, and keep that spirit of helpfulness alive.
Well said. So until next time, deep divers, stay curious, stay informed, and most importantly, stay ready to be the hero you never thought you could be. Okay, so today we're diving into something kind of intense.
Uh-oh.
Yeah, it's submersion injuries.
Oh, well.
But don't worry, we're not, like, turning this into a full-on paramedic course or anything.
Okay.
More like, what happens when things go really wrong in the water
Right.
and how those trained responders, what they do, to handle it.
Yeah, absolutely. It's important stuff, even if you're not, a medical pro or anything like that.
Right, exactly. It's all about being prepared.
Exactly.
Because, we're talking life or death here, potentially.
Undoubtedly. Absolutely. We're talking threats to life, limbs, all sorts of things. And that's why having this this standardized approach, that's what this protocol is really all about.
Right, having that plan in place. So, okay, let's say, just picture this. You're at the beach, beautiful, sunny day, you're enjoying the waves, and suddenly you see someone out there struggling in the water.
Yeah.
What's the first thing you do?
Well, first things first, you got to make sure you're safe. You don't want to just jump into a dangerous situation without thinking.
Yeah.
So try to reach the person, maybe with a flotation device, a rope, even a long branch if you can find one.
Okay.
But if that's not an option,
Yeah.
call for help. 911, that's the fastest way to get the pros on scene.
Yeah, absolutely, because it's easy to, panic in that moment.
For sure.
And jump in, but that could make things worse.
Absolutely.
So let's say, okay, the person's brought to shore, paramedics are there, now what?
So the paramedics, they come in, they assess the situation, and they focus on what we call the ABCs.
The ABCs.
Yeah, airway, breathing, and circulation. Basically, they're checking, is the person breathing? Do they have a pulse? Is their airway clear? And, looking for any obvious injuries.
So those are the immediate priorities.
Exactly.
Now, I was looking at this material, and it talks about some pretty scary stuff like asphyxia,
Right.
hypothermia, pulmonary edema.
Yeah, these are serious conditions for sure.
They sound pretty intense.
But understanding them is super important for responding effectively, right?
Right.
So take asphyxia, for example. Asphyxia is basically suffocation.
Wow.
Yeah, your body's not getting oxygen, and that can damage the brain, other organs really fast.
So restoring breathing is priority number one?
Absolutely. It's critical.
Okay, so asphyxia, that's pretty clear. What about hypothermia? I mean, even if the water's not, freezing cold, that can still be a problem.
Oh, absolutely. You see, water conducts heat away from the body so much faster than air.
I never thought about that.
Yeah, think about it, You get chilled standing in a cool breeze way faster than standing in still air. Same temperature.
That's true.
Same idea with water. Even if it feels kind of comfortable, your body can lose heat really, really quickly.
So it's not just about the water temperature, it's about, the rate of heat loss.
Exactly.
Okay, that makes sense. Now, pulmonary edema, this one sounds like straight out of, a medical drama.
Uh-huh.
Yeah.
Yeah, you could say that.
What is that?
So pulmonary edema is basically fluid building up in the lungs.
Oh, no.
Yeah, and it makes it super hard to breathe. Imagine your lungs filling up with water balloons.
Oh, gosh.
It's serious, can happen after submersion, needs immediate medical attention.
So you've got all these immediate threats to think about.
Right.
But this protocol also talks about figuring out what caused the incident in the first place.
Right.
Why is that important?
It's like detective work, right?
Uh-huh.
So figuring out what happened, that gives us clues about how to treat the person. Let's say someone has a heart condition.
Okay.
Maybe they had a cardiac event that caused them to fall in the water.
Oh, I see.
Or maybe someone was diving and surfaced too quickly.
Right.
And now they've got decompression sickness, the bends.
Right. So knowing the backstory helps you make the right decisions for treatment.
Exactly.
Now, speaking of diving, the material gets really specific about scuba diving injuries.
Mm-hmm.
It mentions things like barotrauma,
Right.
decompression sickness, that's
Yeah.
the bends, and arterial gas embolism.
Mm-hmm.
What is barotrauma?
Okay, think about a bag of chips, sealed bag.
Okay.
You take it up a mountain, the pressure changes, the bag expands.
Yeah.
Same thing can happen in your body when you're diving.
Oh, wow.
Air spaces in your ears, your sinuses, even your lungs, they can be affected by the pressure changes.
It's all about pressure.
Yeah, and in severe cases, it can even lead to a collapsed lung.
A collapsed lung?
Yeah, it's also called a pneumothorax. Imagine a puncture in your lung, it deflates like a tire.
Oh, geez.
That's basically what a pneumothorax is.
That's a really good analogy, actually.
Thanks.
So barotrauma, all
Yeah.
about those pressure changes.
Right?
Now, decompression sickness, the bends, is it really as bad as, like, the movies make it seem?
It can be, yeah. So remember how we talked about pressure changes?
Yeah.
When you're diving, you're breathing air under higher pressure.
Right.
And that forces nitrogen into your tissues. Now, if you come up too quickly, that nitrogen comes out of solution, forms bubbles in your bloodstream.
Well, that can't be good.
No, not good at all. Imagine those bubbles blocking tiny blood vessels all throughout your body.
Oh, wow.
It can cause intense pain, joint problems, even paralysis.
Oh, my gosh.
Yeah. Or even death in extreme cases.
That's really scary.
It's serious stuff.
Okay, and then there's arterial gas embolism.
Right.
That one sounds particularly scary because it involves the brain.
Yeah, it's very serious. So an arterial gas embolism happens when an air bubble enters the bloodstream,
Okay.
often from a lung injury during, a rapid ascent.
So coming up too fast again?
Exactly. And imagine that air bubble, it's like a roadblock in a blood vessel in the brain.
Oh, no.
Yeah. Prevents blood flow, oxygen from reaching that part of the brain. It can be like having a stroke.
That's terrifying.
Yeah, it needs immediate medical attention.
So 3 distinct diving injuries we've got.
Mm.
And the material mentions that paramedics, they gather all this specific information about the dive.
Right.
Like the number of dives, the depth, how fast they came up,
Yeah, all important details.
when the symptoms started. Why is all that so important?
Well, it helps us put the pieces together, differentiate between these different injuries. Like, let's say with an arterial gas embolism,
Okay.
symptoms usually show up really fast, like within minutes of surfacing.
Oh, wow.
But with decompression sickness, it can take hours, even days, for symptoms to appear.
So the timing is really key.
Exactly. Knowing the dive details helps us figure out what we're dealing with and how to treat it.
Now, there's also this point about positioning someone on their left side if you suspect an arterial gas embolism.
Right.
Why is that?
Okay, so think about it. If there's an air bubble in the bloodstream,
Mm-hmm.
we want to try to keep it from reaching the brain.
Yeah.
So lying on the left side, it's not a guarantee, but it might help reduce the risk of that bubble traveling to the brain and causing more damage.
So it's like a precaution
Exactly.
that might make a difference.
Right.
I mean, this is a lot of information, but I think, you start to see how important it is to understand these basics,
Right.
even if you're not like a diver or a paramedic.
Absolutely. Knowing what to look for, how to respond in an emergency, when to call for help, that's what can make all the difference.
Exactly.
It's about empowering yourself, with knowledge that could save a life.
Exactly. Quick action, understanding those potential complications, and getting specialized help,
Mm-hmm.
all crucial in water emergencies.
Couldn't agree more.
Well, thanks for joining us on this deep dive. You never know when this knowledge might come in handy.
Absolutely.
Stay safe out there.
You too. All right. Buckle up for another deep dive. Today, we're going right into the heart of emergency medicine, looking at what paramedics do when they encounter a thermal burn.
Oh, this is a good one. The Burns Thermal Standard is our guide for this, and let me tell you, it gets pretty in-depth.
I bet. It's funny. You think you know a thing or two about burn first aid, but then you start digging into the professional guidelines.
And it can get surprising, the level of detail, the things they have to consider.
Yeah, it's not just running cold water over it, is it?
Nope, not at all. It's a whole system, a thought process designed to keep that patient stable, safe, thinking ahead to problems that could pop up later on.
Okay, well, let's get into it then. The first thing that jumps out at me from the standard is this big focus on scene safety.
Oh, absolutely. You can't help anyone if you become a casualty yourself.
Right.
But
It's not even about the patient at first. It's like, is the environment safe for everyone?
exactly.
Yeah.
It's the foundation, the starting point. If the scene isn't secure, you can't do your job effectively. You might even make things worse.
Like, say there's a gas leak or something.
Exactly. Suddenly, it's not just burns.
Yeah.
You're trying to prevent an explosion.
Wow. So much to think about. And they specifically mention smoke or fumes, too.
Oh, yeah, getting the patient to fresh air, that's got to be top priority in those cases.
Makes sense, but why is it so crucial?
Think of it this way. Smoke, fumes, they're like invisible attackers. You might not see the damage happening, but they could be just as deadly as the flames.
Deadly how?
Well, they displace oxygen,
Yeah.
leading to asphyxia, right?
Oh, yeah.
And then often you have toxic chemicals in there, too. Carbon monoxide's a big one.
Ah, Yeah, right, from the combustion.
Yeah, and that stuff binds to your red blood cells, so oxygen can't get to your organs.
So getting them to fresh air, literally life-saving stuff.
Absolutely crucial.
Okay, scene secure, patient's breathing. What's next? What's the paramedic doing?
Now it's all about prioritization. A rapid assessment, got to figure out the most immediate life threats, what needs to be addressed right this second.
So it's like mental triage, figuring out what could kill them fastest.
Exactly. It's like a 4-alarm fire going off in the body, and they've got to contain it. Airway burns. That's a biggie.
Blocking the airway, I guess?
Yeah, like having the front door blocked during a fire. Then there's asphyxia, like we just talked about, oxygen supply getting cut off.
Right, right.
Then there's the potential for poisoning, carbon monoxide we mentioned, but also cyanide. That can be released during combustion,
That's scary stuff.
like toxins spreading through the house, disrupting everything.
Okay, so airway, breathing, poisoning. What was the last one?
Ah, yes, shock.
Ah.
The body's response to severe injury. It's like the whole house going into emergency shutdown mode.
So blood pressure drops, organs don't get enough blood.
Exactly. Things can spiral downward very quickly.
So it's damage control on all fronts, making sure the most critical stuff is stable before anything else.
You got it. It's high stakes, prioritizing, reacting, all while staying calm and focused. But once those immediate threats are addressed, the paramedic gets to put on their detective hat.
Ooh, detective work. I like it. So what are they looking for? Clues at the scene.
Trying to understand the burn's cause, the circumstances surrounding it. It's not just treating the burn itself, it's getting the whole story, guiding the next steps.
How does the cause of the burn affect the treatment, though?
It's huge.
Yeah.
For instance, if it's a chemical burn, you wouldn't just douse it with water, right? Could react with a chemical, make it worse.
Right, specific neutralizing agents, maybe.
Exactly. Or maybe dry decontamination. Depends on that chemical.
It's like a choose-your-own-adventure book for burns. The cause determines the path you take. What about if it's, a fire, like a regular fire?
Even then, so many factors. Was it in an enclosed space? Was the patient unconscious during the fire?
Why does that matter?
Well, enclosed space means higher chances of smoke inhalation, deeper burns maybe. And cyanide, that's a big concern with fires, especially in enclosed spaces.
Cyanide from the smoke.
Yeah, it's a byproduct of incomplete combustion. Scary stuff.
So they're not just treating a wound, they're piecing together this whole event to anticipate problems.
Exactly. Like a detective, the more pieces of the puzzle they have, the better they can tailor the treatment.
Okay, scenes safe, life-threatening stuff's handled, detective work's done. Now what?
Now comes the obvious but crucial part.
Yeah.
Stop the burning process.
Sounds simple enough.
It is, but in the heat of the moment, it can be easy to overlook.
You're so focused on the big picture, you forget the immediate issue.
Exactly. Could be dousing flames, removing smoldering clothing, separating the burn from the heat source, whatever it takes.
The standard mentions cutting around clothing stuck to the skin. Why not just pull it off?
Oh, you never want to do that. Imagine peeling a sticker off a delicate surface. That's what you'd be doing to burned skin.
Ripping off damaged tissue.
Yeah, increasing pain, making the injury worse. Cutting around it prevents more trauma to that area.
Ouch, yeah, I see why that's important. So, burning stopped. What's next? Full body assessment time.
You got it. That's where they really evaluate how extensive the burn is. And here's where that rule of nines comes in. You ever heard of that?
Yeah, rings a bell, but I'm a bit fuzzy on the details. How does that work again?
Picture this. You're dividing the body up into sections, each one representing a multiple of 9%.
Okay, like a human body connect the dot puzzle. Each dot's a percentage.
Exactly. It helps paramedics quickly estimate how much of the body surface area is burned.
Okay, walk me through it. What are the sections?
All right, for adults, head and neck together, that's 9%. Each arm, front and back, that's another 9%, so 18 for both arms.
Gotcha. So far, so good. What about the torso?
Front of the torso, chest to abdomen, that's 18%. The back, including the buttocks, another 18%, so 36% total for the torso.
All right, so we're up to 63% already. Legs.
Each leg, front and back, another 18%. That's 36% for both.
And that leaves 1% for the groin area.
You got it. Might seem small, but even a small burn there can be incredibly painful, needs specific care.
Absolutely. So if we add it all up, 9 for the head, 18 each arm, 36 the torso, 36 the legs, and 1 for the groin, that brings us to 100.
Exactly. And the cool thing is, this system works even if the burn itself has some weird shape.
It's a mental shortcut to judge how bad the burn is, right? Especially when time is crucial.
Precisely. But you mentioned something earlier, Children have different body proportions, so the rule of nines needs a tweak.
Right. Their heads are proportionally bigger, legs shorter. How's that factored in?
It's called the modified rule of nines. In this version, the head takes up 18% instead of 9, and each leg is 14% instead of 18%.
So they shift some percentage from the legs to the head.
Exactly. Got to adapt to those crucial differences.
Wow, this assessment is so detailed. But it's not just about size, is it?
You're right. They also got to look at the depth of the burn. First degree, just the outer layer of skin. Second degree, deeper. Or third degree, all the way through.
So they're figuring out how bad the damage is, layer by layer.
Exactly. And while they're at it, they're checking for good blood flow and nerve function, especially in the limbs.
Why is that so important?
A burn can really mess with blood vessels and nerves, disrupts blood flow, sensation to the area. That's why they check pulses, capillary refill, sensations, especially in burned limbs.
Making sure the burn isn't cutting off circulation or messing with nerve function.
Exactly. Could lead to more complications if it's not addressed quickly.
It's like making sure the infrastructure's still intact, everything's connected and working.
You got it. That attention to detail, that focus on the obvious A&D, the subtle, that's what makes their assessments so thorough and vital for recovery.
Okay, so burn itself is assessed, but what about those hidden dangers we talked about earlier, like smoke inhalation? How do they check for that?
That's another key piece of the puzzle, and it's not always as obvious as you might think.
So what are they looking for? Telltale signs.
One thing they'll do is listen closely to the patient's voice. Is it hoarse? Raspy? Could be irritation or swelling in the vocal cords.
So even a slight change in voice could be a red flag.
Absolutely. And they'll be listening to their breathing too. Coughing, wheezing, labored breathing.
Wouldn't the patient themselves mention those things, though?
You'd think so, but sometimes those signs can be very subtle, especially at first. The paramedic might notice a slightly faster breathing rate or a faint whistling sound when they breathe in.
So it's about picking up on those things the patient might not even realize.
Exactly. And then there are the visual clues. They'll look in the patient's mouth and nose, check for soot or burns, even look at their skin color. Seeing if there's a bluish tint could mean lack of oxygen in the blood.
Gathering info from all over, what they see, what they hear, even what they might smell.
Exactly. Human sensors, constantly on the lookout for anything amiss. And remember, those early signs can be very subtle.
Which is why it's so important for the paramedic to be so thorough, so observant.
Because those subtle signs could be the tip of the iceberg.
A warning of worse things to come.
You got it. Smoke inhalation, it can really damage the lungs, the airways, and those problems they can develop over time.
So the paramedic isn't just treating what they see right then, but thinking ahead, preventing future complications.
Exactly. And that brings us back to the importance of getting that patient to the hospital for further evaluation, further treatment.
Even if they seem okay at the scene.
Even then, things can change, especially with something like smoke inhalation. The full extent of the damage, it might not be obvious right away.
So better safe than sorry, get them to the experts.
Exactly. And that's where the paramedics' expertise shines. They're not just doing first aid, they're making critical decisions about the best course of action.
And those decisions, they can have a huge impact on how well the patient recovers.
Absolutely. They're the guardians of those first few critical hours after an injury.
Making sure the patient gets the right care at the right time.
That's it. And it highlights the incredible responsibility they carry. They're not just treating a physical injury, they're managing the whole situation, anticipating problems, advocating for the patient every step of the way.
Okay, we've talked about scene safety, the rapid assessment, figuring out the burn, its complications. What about the actual treatments? What are they doing on scene to help the patient?
That's where things get interesting. For example, most people think you should immediately apply ice or ice water to a burn, right?
Yeah, seems like the logical thing to do, cool it down.
Right. But it can actually be harmful, especially for bigger burns. The standard actually says for burns less than 15% of the body, you use cool water, not ice water.
Wait, really? Why not ice water? I thought that was the best way to bring down the temperature.
Problem is, ice can lower the body temperature too much, leading to hypothermia. And remember, the body's already in shock after a burn.
Right, so adding cold on top of that can make things worse.
Exactly. It's about finding that balance, cooling the burn without dropping their core temperature too low.
And what if they start shivering or their blood pressure's low?
Stop cooling them immediately. Those are signs of hypothermia.
Got it. Cool water, limited time, and watch out for hypothermia. What about pain relief? Burns are notoriously painful.
Oh, absolutely. Managing pain, that's crucial. They might give pain meds if it's appropriate,
Hmm.
and they'll try to make the patient as comfortable as possible.
How do they do that?
Things like elevating burn limbs to reduce swelling, being super gentle when they handle the burn, avoid any movement that could cause more pain.
It's treating the patient with, understanding, recognizing what they're going through.
Exactly. That human connection, it makes a huge difference in how a patient copes with the pain and fear.
It's like they're not just treating the injury, they're treating the whole person.
You hit the nail on the head. That holistic approach is what sets paramedics apart. They're not just technicians, they're caregivers.
Bringing both their knowledge and their humanity to the situation.
That's it.
Speaking of knowledge, I think it's time we got to some of those surprising details you mentioned earlier, those things that might go against what we think we know about burn care. Ready to bust some myths?
Well, I'm always up for some myth busting.
Hmm.
Let's start with this whole moist dressing thing. I think
Sure.
that'll surprise a lot of people. All right, so moist dressings. This is where it gets kind of tricky. Most people think burn, heat, bad, got to cool it down with something wet.
Yeah, totally. Cold water, aloe vera gel, that's what I've always heard.
It seems logical, but our intuition isn't always right, is it? The standard, it actually has very specific rules about moist dressings, when to use them, and surprisingly, when to avoid them completely.
Okay, so remind me, what are the rules?
Right. Imagine a minor burn. First degree, maybe a mild sunburn, or a small second-degree burn. Something less than 15% of the body surface area.
Okay, got it.
In those cases, a moist, sterile dressing can be helpful, provides some cooling, keeps the wound clean, can even help it heal faster.
Gotcha. Moist for minor burns, like a little soothing spa treatment for the skin. But what about bigger burns? Seems like those would need even more moisture to cool down.
That's where it gets interesting. For larger burns, those covering 15% of the body or more, A&D for all third-degree burns, the really deep ones, the standard actually says dry, sterile dressing only.
Wait, no moist dressing at all, but wouldn't that dry out the wound, make it worse?
I know, right? It seems counterintuitive. But there are a couple of reasons for that. First, with a big burn, there's a higher risk of hypothermia. And a moist dressing over a large area, it can actually make that worse.
Right, gotta maintain that balance, cooling the burn without dropping their body temperature too low.
Exactly. And second, with bigger, deeper burns, the risk of infection goes way up. A moist dressing, it can be a breeding ground for bacteria.
Ah, so a dry dressing helps keep it, drier.
Exactly. Absorbs drainage, helps prevent infection, and that can actually promote healing in those more serious cases.
So it's almost like a shift in priorities. Small burn, you're soothing, protecting the skin. Big burn, infection control becomes the main concern.
Exactly. Different situations, different approaches. Sometimes what seems counterintuitive is actually the best thing to do based on the evidence.
Okay, I'm seeing how these little details can make a big difference. What other myths are out there that we need to debunk?
Let's talk blisters. Another one where our gut instinct might be wrong. You see a blister forming on a burn. What do you want to do?
Pop it? Relieve the pressure, right?
Knew you'd say that. It's what a lot of people would do. But guess what? The standard says leave those blisters alone.
Seriously, why though? Seems like popping it would help the fluid drain, let it heal faster.
It seems that way, but that blister, it's actually a natural bandage, protecting the tissue underneath from bacteria and stuff.
So popping it just increases the risk of infection.
Yep, disrupts that barrier, could actually delay healing.
Huh. Like those blister packs you get with new electronics. They look like they need popping, but they're protecting what's inside.
Exactly. Another case where our initial instinct isn't the best approach. Sometimes the body knows best, let it do its thing.
Hands off of blisters. Got it. What else?
Let's go back to cooling burns for a second because I think there's still some confusion about this.
Right, like ice water versus cool water.
Exactly.
Yeah.
The standard is crystal clear.
All right.
Burns less than 15% of the body, cool water only, no ice water, and no more than 30 minutes of cooling.
Because of hypothermia, right. We talked about that.
That's a big part of it. But even with smaller burns, there's a risk of overcooling.
Really? How so?
Think about it. The burn is damaging the skin, the tissues. Overcooling can damage those cells even more, adding insult to injury, so to speak.
So it's about finding that balance again. Cooling enough to help, but not so much that you make it worse.
Exactly. And it's not just the temperature, it's the time. 30 minutes max. That's based on research. Longer cooling doesn't help and can actually increase the risk of problems.
Cool water, limited time, and keep an eye out for hypothermia, like shivering or changes in blood pressure.
You got it. It's a balancing act, requires careful assessment and ongoing monitoring.
Okay, cooling protocols down. Anything else we need to remember about caring for burns?
One thing that's often overlooked is keeping the patient warm. Seems counterintuitive, right?
Yeah.
We're dealing with burns, but preventing hypothermia is a big deal in burn treatment.
Right. The body's ability to regulate temperature can be messed up after a burn.
Exactly. Their internal thermostat can be all out of whack. So even though the burn might feel hot, their core temperature could be dropping. And that's dangerous.
So how do they keep burn patients warm? Seems tricky. You don't want to overheat the burn, but got to keep the rest of them warm.
It is tricky, yeah. Blankets, warm IV fluids if needed, even special warming devices sometimes.
Like creating a little protective cocoon around them, keeping their temperatures stable.
Great analogy. It's all about supporting the body's natural healing processes.
Okay, so cooling, blisters, warmth. Anything else for our burn care toolkit?
One more myth I want to tackle, and it's about something we mentioned earlier, scene safety.
Right, making sure the environment's safe before you go near the patient. Seems pretty straightforward though, right? No fire, no immediate danger.
You'd think so, but it's more than just the obvious stuff. Scene safety, it's also about those hidden dangers that might not be so obvious.
Okay, give me an example. What kind of hidden dangers?
Imagine a chemical spill. Maybe the immediate threat's gone, but there could be fumes or particles in the air, dangerous to both the patient and the responders.
So you have to take a step back, look at the bigger picture. Not just the obvious dangers, but the potential for things you can't see.
Exactly. And that's where a paramedic's training is so crucial. They know how to recognize those subtle clues, ask the right questions, make smart decisions.
So it's not just about rushing in to help, it's about being strategic, taking precautions to keep everyone safe.
Exactly. Slow is smooth, and smooth is fast. By taking the time to assess the scene thoroughly, they can actually provide field care in the long run.
Okay, I'm starting to see how it all fits together. Scene safety, the rapid assessment, understanding the burn and its potential problems, then providing the right care while thinking ahead to what might go wrong. It's complicated.
It is, and it takes knowledge, skill, and compassion. It's amazing what these paramedics do.
They really are. It's like a carefully choreographed dance, all these actions, decisions, working together to get the best possible outcome for the patient.
That's a great way to put it. And that's what makes their work so remarkable. They're constantly balancing those priorities, making tough decisions under pressure. And they do it with amazing grace and composure.
I couldn't agree more. They're the unsung heroes of emergency medicine.
Absolutely. Running towards danger when everyone else is running away, day after day, no hesitation.
The embodiment of courage, compassion, dedication, it's inspiring.
It really is.
And, speaking of caring for others, I think we should talk about something that often gets overlooked, the psychological impact of burns. It's one thing to treat the physical wounds, but what about the emotional and mental scars that can last long after the burns have healed?
That's a really important point. The psychological impact, it can be huge.
So let's talk about that. What are some of the emotional challenges burn survivors face?
Well, they often experience a whole range of emotions. Shock, fear, anxiety, anger, sadness, even guilt sometimes.
It's traumatic, right? Their body feels different, their appearance might have changed, their whole world has been turned upside down.
Exactly. And for many survivors, that emotional healing, it can be just as hard, if not harder, than the physical healing.
So how do we support them? What resources are out there?
There are a lot of approaches that can help. Individual therapy, support groups, even special burn camps where they can connect with others who understand what they're going through.
It's about creating a community, a support system where they can share their experiences, learn how to cope, and regain a sense of hope.
Exactly. And it's not just professional help either. Family, friends, they play a huge role. Just being there to listen without judgment can make a world of difference.
Sometimes just having someone who cares, who understands, that's all it takes. It reminds us that healing isn't just physical, it's about the whole person, mind, body, and spirit.
Well said. And it shows how resilient the human spirit can be. Overcoming adversity, finding strength in the face of vulnerability, coming out of these incredibly tough experiences with a renewed sense of purpose.
That's a beautiful way to put it. And I think it leads us perfectly into some of those final surprising details from the burns thermal standard that we keep talking about.
Yeah, let's dive back into those. We've busted some myths, but there are always more out there waiting to be challenged.
It's amazing, right? We think we know something about first aid, then we do a deep dive like this, and I realize I've got so much to learn.
It's humbling, isn't it? We get so much information thrown at us. But is it good information? Is it up to date? That's what I love about these standards. They cut through the noise.
They're the real deal, based on evidence, not just what your grandma told you.
Exactly. Sometimes our instincts need a little help from the experts.
All right, so to wrap up this exploration of thermal burns, let's hit a few more of those surprising details from the standard. I feel like we've only just scratched the surface.
Let's do it. Myth-busting time.
Okay, how about this one? Removing jewelry from a burn victim. I always thought you were supposed to do that.
Seems logical, right? Get anything restrictive off before the area swells up. But the standard actually says, don't remove jewelry unless you absolutely have to.
Wait, seriously, why not? Wouldn't a ring or a bracelet cut off circulation as the area swells?
It could, and if there's a clear sign that blood flow is compromised, then yeah, you might have to take it off.
Yeah.
But the standard emphasizes that most of the time, removing jewelry can actually cause more harm than good.
Okay, now I'm really curious. Explain this to me.
Think about it. Jewelry, especially metal, it conducts heat. So if you try to pull a ring off a burned finger, you could burn them even worse.
Oh, right, the friction, the metal heating up.
Exactly, like using a hot poker to try to remove another hot object. Plus, removing jewelry, it can be painful, especially on damaged skin. And sometimes, the swelling makes it impossible to get it off safely anyway.
So unless it's absolutely crucial for medical reasons, leave the bling alone.
Let the pros handle it. They know what they're doing.
Okay, what other surprising details did we want to cover?
How about antibiotics for burns? A lot of people think you need antibiotics for any burn to prevent infection, but the standard actually says antibiotics are not routinely recommended for thermal burns.
Hold on, really? Burns are open wounds? They seem like they'd be prime targets for infection.
They are, but the standard makes a distinction between preventing infection and treating an existing infection. Our bodies are pretty amazing. Our immune system can often fight off bacteria on its own, especially if the wound is cleaned and dressed properly.
So it's about trusting the body's natural defenses, not jumping to antibiotics right away.
Exactly. Overusing antibiotics leads to resistance, and that's a huge problem. So the idea is to use them only when you really need them, when there's a clear infection that needs that extra help.
Antibiotics are a tool, but not the first one you reach for.
Exactly. Weigh the risks and benefits, make the choices that support healing, and minimize harm.
Man, this has been eye-opening. I feel like I have a whole new understanding of burn care.
That's what we like to hear. It's been great exploring this with you, busting those myths, getting into the details.
It really has. Any final words of wisdom for our listeners before we wrap up?
Just remember, burn care is a field that's constantly evolving. The best way to stay in the know is to look for reliable information. The Burns Thermal Standard, that's a great place to start. Don't rely on old wives' tales or what you read on some random website.
Be curious, be informed, be safe.
That's it.
And remember, knowledge is power. Knowing what to do in an emergency can literally save a life. So keep learning, keep exploring, keep those deep dives going. We'll be back soon with another fascinating topic, ready to uncover more hidden knowledge and challenge those assumptions. See you then.
You just never know what you're going to get, right? I mean, in an emergency situation, we're talking toxicological emergencies.
Right.
Poisonings, overdoses, pretty scary stuff. We're diving deep today into how paramedics handle these situations.
Okay.
And get this, we're going right to the source, the actual guidelines they use out in the field. So by the end of this, you'll see these emergencies through the eyes of a first responder. Understanding the clues they're searching for, the dangers they're facing.
Yeah, that's such an important perspective, the first responder.
It is.
It is.
And it can be so quick.
Yeah.
And they have to think on their feet. And these guidelines, it's interesting because they really stress that whole detective work aspect.
Oh, absolutely. It's all about information gathering.
Yeah.
It's not just like, oh, there's a poisoning we need to, figure out. It's like, what is the substance? How much was there? How did it get into the body? Was it swallowed, injected, all that? Like, when did this happen?
It's like a real-life medical mystery.
Yeah.
The guidelines even mention checking prescription dates.
Right.
Leftover amounts. If it's medication, detail.
Well, yeah, because even that, think about it. Someone overdoses on a heart medication.
Right.
Knowing if it was, a couple days ago they got that prescription or if it was from a long time ago and they, got a refill or whatever, that can change how much is in their system, how you treat them. what antidote you might give, if it's appropriate at all that.
Yeah, that makes a lot of sense. Now, what happens if the patient is unconscious?
Oh, right.
I saw that the guidelines mention a specific protocol, the altered level of consciousness standard.
Right.
What's that all about?
Well, an unconscious patient, it adds another layer.
Yeah.
They can't tell you what happened.
Right.
So the paramedics, they have to really rely on just their observations and their assessments, like what's their breathing like, how do their pupils look, skin color, reflexes. And so this altered level of consciousness standard, it gives them a roadmap, for figuring things out in that really tough scenario.
It's amazing how much they have to piece together so quickly.
Yeah.
And, speaking of challenges, there's this whole list of potential problems in the guidelines
Right.
that paramedics have to be ready for. Cardiac arrest,
Oh, yeah.
blocked airways, breathing difficulties, respiratory arrest.
And then it even gets more like altered consciousness, violent behavior, dangerously high body temperature,
Yeah.
seizures, vomiting. It just, all that goes to show just how much of the body a toxicological emergency can affect.
Right, it's like a cascade.
Yeah.
It's not just about the substance itself, it's all the potential dominoes.
Exactly. And that's why, again, figuring out those specifics early on is so, so crucial.
Yeah.
It helps them be ready.
Absolutely. Now, was there a certain type of toxicological emergency that stood out to you in the guidelines?
Well, yeah, they really focused on carbon monoxide poisoning, almost like a case study.
Interesting. Why? What makes that so unique?
Well, it's sneaky because you can't see it. You can't smell it.
Oh, wow.
Yeah, carbon monoxide, it stops your red blood cells from carrying oxygen, basically suffocating your body.
Oh,
And the symptoms, they can be so general, like, oh, I have a headache, I'm dizzy, I feel nauseous,
right.
weak, confused. I mean, who hasn't felt that way at some point?
Exactly, yeah.
So it can be really easily missed.
It could be anything, right?
Exactly. And it can even get worse. Irregular heartbeat, seizures, losing consciousness.
Oh, wow.
So that's why the guidelines, they really highlight, like, okay, you got to think about carbon monoxide poisoning in certain situations, enclosed spaces, fuel burning appliances.
Right.
Like if you're in a garage and the car's running,
Yeah.
or a house with a broken furnace, things like that, it can be deadly.
You think, having those carbon monoxide detectors.
Oh, absolutely essential.
Yeah.
Lifesavers, really. And for paramedics, they're trained to notice those little things, put the pieces together, and connect it back to the environment.
Mhm.
Because a wrong diagnosis, it can be, really, really bad.
Right. So, after this deep dive,
Yeah.
what's the biggest takeaway?
Well, I think we've seen how complex these toxicological emergencies are. I mean, it's a lot more than just, oh, someone took too much of something.
Yeah.
It's about being fast, systematic, thinking about all those possible problems.
Right.
But really, I think the biggest thing is recognizing it early, acting fast, whether it's the paramedic or someone at home, like you were saying.
Right.
That quick action, it can make a world of difference.
Absolutely. That's powerful. And it makes me think, knowing how complicated all this is,
Yeah.
how can we be better prepared as individuals, as communities? What do you think?
Yeah.
What can we do?
Well, I think that's a great question to leave our listeners with. What can we each do?
Yeah.
Because it could be any one of us at any time. It's about awareness. It's about knowing the resources and maybe even starting those conversations.
Yeah.
Being prepared.
Great point.
Yeah.
Well, food for thought for everyone out there.
Yeah.
Thank you so much for diving deep with us today. Until next time, stay safe, stay curious.
Thank you.
All right, everybody, welcome back for another deep dive. Today, we're going to be looking at something pretty exciting, I think, at least for me, critically. We're going to be looking at how paramedics prepare for trauma situations.
That's right.
And we've got some great source material here.
Absolutely.
Section 3 of a document focusing on trauma standards. So our goal today is to understand what are the key pieces of trauma care from a paramedic's perspective.
Yeah, and I think what's fascinating about these standards is that they're not just some dry textbook stuff,
Right, yeah.
This is literally a roadmap to making life-saving decisions under pressure in the field.
Like when you're in the thick of it.
Absolutely.
Yeah, and the first thing that really stood out to me in this document was how trauma standards aren't one size fits all. I mean, that makes sense logically, right?
Yeah,
Like we know a broken leg and a head injury need different care.
Of course.
But what are we really talking about here? What kind of differences in approach would a paramedic need for, say, a penetrating chest wound versus like a severe burn?
That's a great question. And, in trauma care, like we said,
Yeah.
time is absolutely critical. Every second counts.
Right.
So paramedics have to assess the situation quickly and act fast,
Right.
but they also got to act smart.
Right.
A standardized approach for every single trauma just wouldn't be effective.
Wouldn't cut it.
It wouldn't cut it exactly. So with a chest wound, for example,
Yeah.
you're immediately thinking about things like a collapsed lung,
Oh, wow.
potential heart damage, controlling the bleeding,
Right.
whereas with a severe burn, the focus shifts completely.
Okay.
You're worried about fluid loss infection, risk pain management.
Got it.
So each injury really demands a very specific set of skills and knowledge.
So it's really about being efficient and targeted.
Absolutely.
But the document goes beyond just treating what you see, right?
Yeah.
It's like paramedics are almost like medical detectives in a way,
Yeah.
constantly searching for clues
Yeah.
that something more serious might be going on.
Yeah.
So what are some of the subtle signs that might make a paramedic suspect that a complication is brewing, even if the initial injury seems pretty straightforward?
You hit the nail on the head, That preparedness mindset that you mentioned, that's really what separates the good paramedics from the great ones.
Oh, interesting.
It's all about anticipation. Let's say someone comes in with a fractured arm after a fall.
Okay. Yeah.
Now, a less experienced responder might just focus on the fracture itself.
Right.
But a seasoned paramedic,
Yeah.
they're going to be looking for other indicators.
Like what?
Is the patient confused or disoriented? That could suggest a concussion.
Okay.
Is their skin pale and clammy?
Oh,
Maybe internal bleeding?
wow.
Are they having trouble breathing,
Yeah.
even though their chest seems fine?
Right.
That could point to a punctured lung.
That's scary.
These seemingly subtle clues can be the key to catching those hidden dangers before
Yeah.
they become life-threatening.
Wow, it makes you realize how much is riding on a paramedic's ability to observe and interpret those subtle cues.
Absolutely. Every detail matters.
And speaking of complexity, the document also brings up something called concurrent conditions.
Right.
What does that mean in the context of trauma care?
So concurrent conditions essentially refer to the idea that a patient's existing health issues
Right.
can have a huge impact on how a paramedic approaches their care.
Oh, okay.
It's about seeing the whole picture. Let's
Yeah.
say you have someone with a pre-existing heart condition
Okay.
and they experience a severe fall.
Right.
Now, the trauma itself is a major concern, obviously,
Of course.
but the paramedic also has to consider how the stress of the situation
Okay.
might affect their heart.
Right.
Are their medications interacting with any pain relief they might need?
Okay.
Is their heart rate stable?
Got it.
These are all critical factors that come into play.
It really highlights how much more is going on than just fixing the immediate injury.
Exactly.
You have to understand the whole person.
It's holistic,
Yeah, their medical history, their current state is pretty incredible.
It is, and we can't forget about the fundamentals.
Right.
The ABCs, airway, breathing, and circulation.
Right. The essentials.
These are absolutely paramount in every single trauma situation.
Of course. But this document goes even further, mentioning things like neurovascular compromise, seizures, shock-altered mental states, even vomiting.
Right.
Why are these additional concerns so crucial for paramedics to monitor?
Because each one of those can signal a serious underlying problem.
Okay.
Or potentially worsen the existing trauma,
Yeah,
It's about being proactive, not reactive.
Right.
I remember this one case. A patient came in after what seemed like a pretty minor fall.
Yeah.
He seemed stable initially,
Okay.
but then he started vomiting.
Oh,
Turns out he had a severe concussion.
wow.
And the vomiting was a sign of increasing pressure in his skull.
Oh, no.
Had we not caught that early on, the outcome could have been really bad.
So it's not just about treating the visible injury. You have to be constantly vigilant for those less obvious complications that could be lurking beneath the surface.
Precisely. And that's why the document also emphasizes the importance of ALS patient care standards, or ALS PCS.
Okay, what are those?
This essentially ensures that paramedics are providing the highest standard of care, delivering comprehensive medical support beyond just treating the immediate injury.
So it's really about treating the person, not just the trauma.
Exactly. It's a holistic approach.
That's a really important distinction. So for someone listening to this, what's the biggest takeaway from all this? We've talked about different trauma standards, anticipating complications, the ABCs, and so much more.
You're right, it's a lot to digest.
It's a lot.
But I think the key takeaway is that emergency medical care is incredibly complex.
Yeah.
It requires this unique blend of skill knowledge and adaptability.
Right.
And, for those listening who are fascinated by this world, and I think it is fascinating,
Yeah.
there are so many ways to explore it further.
Oh,
volunteering at a local clinic, shadowing an EMT, even taking a basic first aid course. These can all provide a glimpse into this challenging and incredibly rewarding field.
That's great advice, and you never know, it might just spark a lifelong passion.
Absolutely.
All right, that's all the time we have for today's deep dive. We'll see you next time. Welcome back, everyone. Today we're doing a deep dive into something that might sound a bit technical at first. Syncope, dizziness, and vertigo.
Mm-hmm.
I'm fascinated by these conditions.
Yeah.
The source material you gave me on how paramedics respond to these situations it's really intense.
Yeah.
And I think it's something that, we all experience dizziness at some point in our lives.
Absolutely.
But I think understanding this protocol really gives us a window into how serious these symptoms can be.
Right.
And the wide range of potential causes.
Yeah.
So buckle up. This one is a bit of a medical mystery tour.
It is.
So before we get into the nitty-gritty, I think it would be great to kind of define these terms.
Sure.
Because I think a lot of times people use dizziness, syncope, and vertigo interchangeably.
They do, yeah.
But in the medical world, these are very distinct things.
Absolutely.
So maybe we could start there.
Yeah. So when we're talking about syncope, really what we're talking about is fainting. So that's a temporary loss of consciousness. Dizziness, on the other hand, is kind of just what it sounds like. It's that feeling of being lightheaded, unsteady.
Okay.
You know that feeling if you stand up too quickly and you kind of get that head rush?
Right.
Vertigo, though, that's a different beast altogether. That's a specific type of dizziness.
Okay.
Where you feel like either you or the room is spinning.
Oh, wow.
Yeah.
So those are three very distinct experiences, I get.
They are.
And they can all feel pretty scary.
Absolutely.
I mean, I've experienced all three, and they can be really alarming.
Yeah.
But it sounds like from this paramedic protocol that, they're taken very seriously for a reason.
Well, and that's the thing. I mean, it might seem like just a simple fainting spell or a little dizziness.
Right.
But it can be a sign of something much more serious going on.
Right.
So the paramedics, they have this really systematic approach, to rule out these serious conditions and to stabilize the patient.
Yeah.
And that's what we see in the source material.
Yeah.
That, there's this real emphasis on potential life threats.
Right.
Things like cardiac dysrhythmias, hypotension, seizures, decreased consciousness.
Yeah. I mean, when I was looking at that list, it's pretty intense.
It is. And I think that's what's so important to understand.
Yeah.
These paramedics, they're not just there to kind of, give you a Band-Aid and send you on your way.
Right.
They're really trying to figure out what's going on?
Yeah.
What's the root cause of these symptoms?
Yeah, it's so interesting. The source material really emphasizes that paramedics are kind of gathering clues.
Absolutely.
They're like medical detectives on the scene.
Exactly.
Trying to figure out, the underlying cause and make sure that, it's not something super serious.
Yeah, and they're looking for patterns, you know. They're asking questions about your medical history, any medications you're taking.
Right.
Recent illnesses, all of that kind of stuff. Because any little detail could be the key to, cracking the case.
Yeah.
And getting you the right treatment.
Yeah, if that makes me think about how important it is, when paramedics arrive, to be able to give them accurate information.
Oh, absolutely.
To kind of, think back.
Yeah.
Have you had any recent illnesses? Are you taking any medications? Are you allergic to anything?
Yeah.
All of that.
All that.
Because it could be really crucial to getting the right treatment.
Absolutely.
So let's dive into some of those potential causes.
Sure.
Because the source material lists quite a few.
It does.
And it's a pretty, it's a big range.
Mm-hmm.
Everything from hypoglycemia to stroke to even heat-related illness.
Right.
What's fascinating to me is just the sheer range of possibilities.
Yeah.
It could be something, relatively minor like dehydration or hypovolemia, as it's called in the medical world,
right,
to something as serious as, a stroke.
Yeah.
Or a heart problem.
And that's what I think is so important for people to understand, it's not always something obvious.
Right.
It's not always like, oh, I'm having chest pain, it must be my heart.
Right.
Sometimes it can be these really subtle symptoms.
Yeah.
And it takes a trained professional, like a paramedic,
right,
to be able to kind of tease out what's really going on.
Yeah. Out of all those causes, is there one that you think is maybe the most commonly misunderstood or maybe people don't realize?
Yeah. I think hypovolemia is a big one.
Okay.
Low blood volume.
Okay.
People don't always realize how much even mild dehydration can affect their balance and lead to dizziness.
Right. Okay.
Think about it. When you're severely dehydrated, your blood volume drops, right?
Yeah.
And that can lead to dizziness or even fainting.
Hmm.
So, even if you're just feeling a little bit off, a little bit lightheaded, it's important to make sure you're staying hydrated.
Yeah.
Because it could be something as simple as that.
That's a good reminder that, even seemingly minor health issues can have, deeper roots.
Absolutely.
One thing I thought was really surprising in the source material is anemia as a potential cause.
Oh, yeah.
I don't think people realize that.
Anemia, that's a low red blood cell count.
Right.
And basically what happens is that reduces the amount of oxygen that's being carried to your brain.
Mm.
And that can lead to those feelings of lightheadedness, fatigue, all that kind of stuff.
Yeah. So it's really fascinating that, we've got this wide range of potential causes.
Yeah.
And it sounds like the paramedics are really trained to consider all of them.
They are. And that's why it's so important, to call 911 if you're experiencing these symptoms.
Right.
Because, you might think, oh, it's just a little dizziness, it'll pass.
Right.
But it could be something serious. And you want to make sure you get the right treatment as quickly as possible.
Well, this deep dive has been really eye-opening.
Yeah.
It's amazing just how much complexity lies beneath something as common as dizziness.
It is.
Any final thoughts for our listeners?
I think the biggest takeaway here is that it's really important to listen to your body.
Yeah.
While occasional dizziness might be nothing to worry about,
Right.
persistent or recurring episodes should always be checked out by a doctor.
Yeah, it's like our bodies have these fascinating ways of communicating with us.
Mm-hmm.
And sometimes dizziness is that subtle message
Yeah,
that we need to decipher.
absolutely.
Well, thank you so much for taking us on this medical mystery tour.
You're welcome.
It's always a pleasure.
Likewise.
And for our listeners, we'll see you next time for another deep dive.
See you then.
Bye.
Bye.
Okay, so have you ever thought about what it's like
What?
for like a paramedic, racing to a call,
Right.
and the call is just like vaginal bleeding?
Oh, yeah.
Like, how do you even,
Where do you even begin?
like what could that even,
Could be anything.
it could be anything.
Yeah.
From like a normal period to like
Oh, absolutely.
something super serious.
Yeah, life or death kind of thing.
Right, and that's where protocols are so important.
They are. They're like,
Yeah, we're going to deep dive into one today. It's all about,
vaginal bleeding protocol.
vaginal bleeding.
Oh, that's fascinating. It's it's like a window into how paramedics think.
Right.
Like under pressure.
Yes.
Because they're not just treating the bleeding, they're like medical detectives.
They are. It's like Sherlock Holmes.
It is.
But with like,
Or stethoscopes.
stethoscopes and stuff.
Exactly.
So, okay, like walk us through this protocol.
Okay.
What's the very first thing that it says?
So the first thing, and this is critical, the absolute first thing is to look for anything that's an immediate threat to life, limb, or function.
Okay, so like what kind of things?
So think about things like ectopic pregnancy,
Okay.
where the pregnancy is outside the uterus,
Oh, wow.
or placental abruption,
Okay.
where the placenta detaches.
Oh, gosh.
These are situations where you can have massive internal bleeding very quickly.
So they have to rule that out like immediately.
Immediately. Yeah, every second counts. So
Yeah.
that's the first thing.
Okay, so that makes sense.
Yeah.
So it's not even just about the bleeding yet. It's like,
It's bigger picture first.
it's life threats.
Yeah, exactly.
And then, okay, so what happens next?
So once they've ruled out those immediate life threats,
Okay.
they move on to what's called a secondary survey,
Okay.
which is a much more detailed head-to-toe examination.
Got it.
And one of the key things they do during the secondary survey is examine the abdomen,
Okay.
especially if the patient is pregnant.
Oh, I bet that's really important during pregnancy.
It's crucial.
Yeah.
They're looking for any tenderness or rigidity
Okay.
that might suggest internal bleeding or other complications.
So what kind of clues are they looking for specifically in the abdomen?
So when they're examining the abdomen,
Yeah.
they're checking the size and shape of the uterus if it's enlarged.
Okay.
They're feeling for contractions.
Okay.
And they're trying to determine the baby's position.
Wow. So they can actually tell all that just from
Feeling.
feeling. Yeah.
Wow, that's amazing.
Yeah. So these seemingly small details,
Yeah.
they can give them a lot of information.
Yeah, because every little piece
Every little piece.
helps solve the puzzle.
Absolutely.
Okay, so, and then I noticed the protocol also gets really specific
Yes.
about the bleeding itself.
Oh, yeah.
Like, why is it so important for them to note the color
Yeah.
and the amount, and if there are clots.
So this might surprise you,
Okay.
but these details really matter
Okay.
because the characteristics of the blood.
They can tell us a lot about what's going on.
So give us an example.
Okay, so for example, bright red blood.
Yeah.
That usually means that the bleeding is fresh
Okay.
and it's flowing quickly,
Oh,
while dark red blood can sometimes indicate a slower bleed.
interesting.
And clots can be a sign of something more serious.
Okay.
They also have a simple but effective trick to estimate blood loss.
Really?
Yeah, they'll often ask how many pads or tampons have been used.
Okay, so they don't have like a measuring cup?
No measuring cups,
Okay.
but a soaked pad holds roughly 5 milliliters of blood.
Okay, I never do that.
Yeah, it's kind of a handy rule of thumb.
Yeah.
And knowing that normal menstrual bleeding
Yeah.
is usually only about 10 to 35 milliliters,
Okay.
that gives them a point of reference.
Right.
Very-
So it's all relative.
Exactly. It's all about putting the pieces together.
Wow. It's amazing how much information is hidden in plain sight.
Yeah.
Okay, so then what if the bleeding is super heavy?
Oh, so when you're dealing with profuse bleeding,
Okay.
the risk of shock becomes a major concern.
Right, because you're losing.
You're losing too much blood too fast.
Yeah. Okay.
So the protocol
Yeah.
instructs paramedics to place a pad under the patient.
Not just for absorption, but like.
Well, absorption is part of it,
Yeah.
but it's also to monitor the ongoing blood loss.
Right.
They're not just using it to soak up the blood. They're using it as a visual measure.
Oh, that's smart.
Right.
To see how much is being lost.
Exactly. And they'll document the number of pads used.
Okay.
So it becomes part of the patient's record.
That's really clever.
Yeah, it's a simple but effective way to track what's happening.
Okay, so and then the protocol also mentions
Yes.
a separate pathway if sexual assault is suspected.
That's right.
So why is that?
Well, unfortunately,
Okay.
vaginal bleeding can sometimes be the result of trauma.
Right.
And that's a whole other
Ball game.
ballgame. Yeah. Because then it's not just about treating physical injuries, it's
Yeah.
about providing emotional support
Of course.
and making sure the patient's rights are protected.
Right.
So there are specific procedures and guidelines that
Okay.
come into play.
That makes sense.
It's a reminder
Yeah.
that paramedics encounter a wide range of situations.
Yes. It's not always.
Not always straightforward.
No.
Yeah.
It's really quite amazing.
It
The
is.
situations they face.
Yeah, and this protocol is a testament to
Yeah.
their incredible training.
Right.
And what's even more impressive is that it's not static.
Oh, right.
These protocols are constantly being updated,
Okay.
based on the latest research and feedback from the field.
So they're always learning,
Always learning,
always improving.
always striving to provide the best possible care.
So if you were like designing a paramedic training program
Okay.
based on what we've learned today,
Yeah.
what would you emphasize?
I would really emphasize observation skills, critical thinking,
Yes.
and the ability to make life-saving decisions under pressure.
Right.
Because it's not just about following steps.
Yeah.
It's about understanding the why behind the steps.
Right.
And knowing how to adapt when
Yeah.
the unexpected happens.
Yeah, because they're not robots. They're
And not robots.
they have to think for themselves.
Absolutely. They're highly skilled professionals who are
That's true.
constantly learning and adapting.
It's a tough job.
It is a tough job.
Well, on that note, I think we've reached the end
No.
of our deep dive today.
Right.
We learned so much about the vaginal bleeding protocol,
We did.
and it's just amazing how much goes into something,
Yeah, it seems so simple.
right? Like you just think, oh, vaginal bleeding.
Right. Call the ambulance.
Yeah, but there's so much
So much more to it.
to it. Yeah, it's like science and compassion and
Quick thinking.
quick thinking. Yeah, all rolled into one.
It's pretty remarkable.
It is. And so the next time you see an ambulance
Yep.
racing by, think about the paramedics
Yes.
and everything they're doing.
Because they truly are.
Hero.
Souls.
Everyday heroes.
Okay. Well, thanks for joining me
Oh, it's been a pleasure.
for this deep dive, and we'll see you all next time.
See you later. All right, everybody, welcome back. Today we're going to do a deep dive on something that honestly kind of freaks me out a little bit.
Oh, yeah. What's that?
Sudden vision problems.
Yeah.
Like, what if out of nowhere your vision just went wonky? That'd be terrifying.
Oh, for sure. I can see why that would be a bit unsettling.
So for this deep dive, we're going into the world of paramedics.
Okay. Yeah.
We've got their guide for dealing with these vision emergencies, and, they're the first on the scene.
Right. They have to think fast.
Exactly. Every second counts. So imagine you're the paramedic.
All right. I'm there. Got my gear.
The call comes in. Someone's freaking out because their vision's gone haywire. What's like the very first thing that pops into your head?
Honestly, the first thing gotta be ruling out the really scary stuff, the life-threatening conditions, like, is this a brain bleed? Is it a stroke that's affecting their eyes? Or could it be something called acute glaucoma?
Whoa, okay. Those sound pretty intense.
Mm.
Why are those so time sensitive? Like, what makes them top priority?
Well, with those conditions, every second really does count when it comes to preventing permanent damage. So, for example, think about a brain bleed. It's like you've got this increasing pressure inside your skull, and it can mess with all sorts of brain functions super fast, including how your eyes work. Then you've got acute glaucoma. That one's a whole different kind of pressure situation. It's all about a buildup of pressure inside the eye itself, and that pressure can seriously damage the optic nerve.
That's the nerve that connects the eye to the brain, right?
Yep, that's the one. And if it gets damaged, you're talking potential irreversible vision loss. So, yeah, not messing around with those.
Definitely no time to waste. So once they've kind of gotten a handle on those immediate threats, the guide goes into like the actual eye exam. They start checking pupil size, making sure they're equal, how they react to light. It reminds me of like when your car's engine light comes on.
Well,
It's a sign something needs attention.
yeah, I see what you mean. The pupils are those black circles in the center of your eyes, and they should get smaller in bright light, wider in dim light. It's a reflex, right? But if those pupils aren't reacting the way they're supposed to, it could be a sign something's off with the whole neurological system.
Makes sense. But I guess it's not just about the pupils. The eyes themselves can tell us a lot, right? What kind of eye movements would make a paramedic go, something's not right here?
Oh, there are a few things. Like if the eyes can't stay still, they're constantly darting back and forth or they're rolling upwards involuntarily. That kind of stuff can be a sign of a problem with the nerves that control the eye muscles. It could even be a sign of a seizure.
Wow, okay. So eye movements are definitely a biggie. What about, like, the positioning of the eyes?
Yeah, that too. So are the eyes bulging out more than usual? Is one eye kind of looking off in a different direction than the other one? Those things can also point to problems with the brain or the nervous system.
So it's like a whole picture kind of thing. Even seemingly basic stuff, like if the eyes are red or swollen, or if there's a lot of tearing, that matters too, right?
Absolutely. Redness, swelling, tearing, all of that can be a clue to things like inflammation, maybe an infection, or even an allergic reaction. And this might seem obvious, but they also got to check if the person wears contact lenses.
Oh, right. Makes sense. Knowing that helps them rule things out.
Exactly. Contact lenses can cause eye problems on their own, or they can complicate things. So knowing if they're in the picture is important. Another thing they check for is drooping eyelids. It's called muptosis.
Drooping eyelids, muptosis.
Yeah.
Got it. But isn't that, like, kind of normal sometimes? Or is it always a red flag?
Well, yeah. Sometimes it's totally harmless. You know that feeling when you're just exhausted and it's like one eyelid is a little lower than the other? It just won't quite open all the way?
Yeah, I get that sometimes.
Right. But in other cases, it could be a sign of something more serious. Like there's this condition called myasthenia gravis, and it basically weakens your muscles, including the ones in your eyelids. Or it could be a sign of a stroke, or maybe a problem with the nerves controlling the eyelid. So a little ptosis might be normal, but a sudden or very noticeable droop, that's definitely something to pay attention to.
It seems like each little observation is like a piece of the puzzle.
Exactly.
Now, the guide also talks about assessing the person's actual vision. They mentioned checking for distortion or double vision. What would that feel like to the patient? Like, how would they describe it?
Well, imagine you're trying to read something and the words all look wavy, like you're looking through a heat haze, or everything appears doubled, as if you've got two of everything in front of you. It can be super disorienting, makes it really hard to do just about anything.
Yeah, that sounds pretty awful. And then there's vision loss. I guess that could be anything from like blurry patches to complete blindness. How does a paramedic even begin to figure out how well someone can see, like, out in the field?
They've got some pretty clever tricks. They might ask the patient to read something, maybe count fingers held up at different distances, or follow a moving object with their eyes. It's all about getting a quick sense of how well they can see.
Okay, yeah, that makes sense. There's one thing in the guide that really surprised me. It says paramedics might actually patch one or even both of the patient's eyes. Wouldn't that make it harder for them to see what's going on?
It might seem counterintuitive, but there's a good reason for it. Sometimes patching the eyes can help reduce eye movement, which can be uncomfortable, even painful if their eyes are irritated or inflamed. Plus, it cuts down on visual stimulation, which can be helpful if the patient's feeling dizzy or nauseous. Kind of like when you have a bad headache and closing your eyes makes it feel a bit better.
Oh, yeah, okay, that makes sense. The last part of the guide talks about some potential problems that could pop up. Things like changes in consciousness, neurological deficits, and vomiting. Those sound pretty serious.
They are. A change in consciousness. That could mean a neurological problem is getting worse. Neurological deficits, things like weakness or numbness, those can be a sign of a stroke. And vomiting, that can be a sign of increased pressure inside the skull.
So it's like, these are the alarm bells.
Yeah, pretty much. If a paramedic sees those signs, they know something seriously wrong.
It's pretty amazing how much paramedics have to consider in these kinds of situations. We might not be dealing with those same pressures in our everyday lives, but knowing what they look for can make us more aware of our own eye health. I mean, think about it. If you started having sudden vision problems, what would you do? Would you know what to look for? What signs to watch out for? Maybe do a little research on some common eye conditions just in case. You never know, that knowledge could come in handy someday. Might even save your sight.
Absolutely. Knowledge is power, especially when it comes to your health.
All right, everyone. That's our deep dive for today. Thanks for joining us.
See you next time.
Stay safe out there. Welcome back, everyone. Ready for another deep dive?
Always.
Today, we're taking a look at the world of paramedics.
Ooh, those first responders who have to think on their feet, huh?
Exactly. High-pressure situations every single day.
I bet.
And we've got some real insider knowledge excerpts from their actual training standards.
Oh, wow. The stuff that tells them exactly what to do.
You got it. So imagine you're the first on the scene. Every second counts. What are the absolute CT knows?
Must be a lot to keep straight.
Well, that's what we're going to find out.
Yeah.
And trust me, this stuff is fascinating. We're talking everything from, well, you ever think about what you'd do if someone had, like, their intestines eviscerated?
Oh, goodness. No, not really.
Yeah, that's in there.
Okay.
Or how about the best way to handle a snake bite?
Run away.
Not quite.
Mhm.
We're going to learn all about it straight from the source.
This is going to be good. So where do we start?
Let's start broad. The standards emphasize that paramedics are always thinking about potential threats, not just to life, but limb and even long-term function.
Makes sense. They have to triage on the spot.
Right, so it's this mental checklist they're running through to figure out what's the biggest threat right now.
Gotcha. So, like, if we're talking about an abdominal or pelvic injury, what comes to mind?
Well, what might not be obvious is the internal bleeding.
Oh, right. You can't always see it.
Exactly. And organ damage, that could be a big deal.
Serious stuff.
Definitely. And this is where it gets interesting. The standards have this specific no-touch rule for eviscerated intestines.
Wait, what? You wouldn't try to put them back in?
Nope.
Why on earth not?
You'd think you would, right. But actually, messing with those exposed organs can do more harm than good.
You're kidding.
Seriously. Infection risk is huge, plus you could damage the tissue even more.
Never thought about that. So what do you do?
Basically, you protect the area until they can get to surgery. Moist, sterile dressings. Keep things as clean as possible.
So it's about damage control, not trying to fix it then and there.
Right on. Let the surgeons handle the delicate stuff in a sterile environment.
Makes sense. What about pelvic injuries? Those seem like they'd be really tough to manage.
Absolutely, especially fractures. Super unstable. The standards talk a lot about stabilization techniques like sheet wraps or special devices.
Oh, yeah, to keep everything from moving?
Yep. Minimize movement, minimize further bleeding and damage. It's like splinting a broken bone, but way bigger.
Wow. Starting to see how much paramedics have to think about. It's not just the obvious injury, huh?
No way. It's a whole body assessment in, like, minutes.
Crazy. Okay, so let's switch gears. Something a little different. Bite injuries.
Ooh, good one. Okay, we all know about rabies after a dog bite.
Right. Got to get those shots.
But did you know it's not just about the wound itself?
What else is there?
Figuring out the source of the bite is huge EE.
So, like, what kind of animal? Or even if it was another person.
Exactly. Because that helps determine the risk, not just for rabies, but for other diseases too.
Makes sense. So a stray cat bite, even if it seems small, that's something you'd really want to track down, right?
Absolutely. You want to locate that cat, if at all possible. It's about preventing a potentially fatal illness. And speaking of potentially fatal,
Uh-oh, what now?
snake bites. Always got to bring those up when we talk about bites.
Yeah, those are definitely up there on the things I hope never happen to me list.
Right. The standards have a whole section on those, and it's not just about the venom.
What else is there?
Well, think about it. You've got the potential for anaphylaxis.
That's a severe allergic reaction, right?
Yeah, shock. Even tissue death, depending on the snake.
Yikes. So how do they even begin to treat that?
Well, one interesting thing they emphasize is immobilizing the bite area.
Oh yeah, like splinting.
Kind of, but the positioning is key here. It has
Yeah.
to be at or below heart level.
Huh. Why so specific?
It's all about controlling the spread of that venom.
Oh, so keeping it lower slows it down.
Exactly. Helps prevent it from moving through the lymphatic system as quickly.
Clever. So you're not just treating the bite itself, you're managing this whole cascade of potential reactions.
You got it. Every detail matters.
Okay, so bites are clearly a whole thing. What's next on the list of things that make me nervous?
Well, how about chest injuries? Things can get really critical really fast.
Well, right. I mean, anything with the chest, you're talking about breathing, the heart.
Exactly. High stakes. And one of the big threats the standards highlight is tension pneumothorax.
Tension. What now?
Basically, a collapsed lung that starts putting pressure on everything else. The
Yeah.
heart, other organs.
So it's not just the lung that's the problem.
Right. It's the chain reaction it can cause if it's not managed. And if there's an open chest wound, special dressing time.
Special dressing, what kind?
It's got to have this one-way valve that lets air escape but prevents more from getting in.
Oh, like to relieve the pressure.
You got it. That valve can be a real lifesaver.
Wow. So they're not just like slapping a bandage on there.
Nope. Everything's very deliberate. And speaking of deliberate, the standards talk about adjusting ventilation for some chest injuries.
The ventilation, like how much air they're giving.
Yep. Volume, rate, all of that. And here's the thing. Sometimes they'll actually use lower ventilation volumes.
Wait, what? Wouldn't you want to give them more air if they're having trouble breathing?
You'd think so, right?
Yeah.
But it all comes back to pressure. Sometimes forcing too much air in can actually make things worse.
Huh. So they're constantly adjusting their approach based on what they're seeing.
Exactly. It's about finding that balance for each specific injury.
That's incredible. They have to be so adaptable.
They do. Okay, we've covered some pretty intense stuff. Internal bleeding, collapsed lungs.
I'm starting to feel a little faint. Just kidding. But yeah, maybe we need something a little less intense for a minute.
You're right. Okay, let's switch gears again. How about eye injuries?
Eye injuries, those don't seem quite as dramatic.
I know, right? You think of them as kind of minor. But the standards, they take eye injuries seriously.
Really? Like, what's the worst that could happen?
Well, the big thing they emphasize is that you should always assume vision is threatened.
Whoa, okay, that's serious. Even if it looks like a little scratch.
Even then. And they have some really specific instructions depending on the type of injury. Like, if the eyelids are swollen,
Yeah.
you keep them closed.
But wouldn't you want to see what's going on underneath?
You'd think so.
Yeah.
But forcing the eyelids open can actually cause more damage.
Especially if there's something stuck in there, I imagine.
Exactly. So, better to be safe and let the ophthalmologist handle that.
Makes sense.
And if there's any suspicion of a rupture or puncture, forget about it.
Forget about what?
Touching it, palpating, irrigating, putting any pressure.
Yeah.
It's a big no-no.
Wow, no kidding. Why so many restrictions?
Because you're dealing with an already compromised eyeball, right?
Right.
So any extra manipulation could just make things worse. Irreparable damage, even.
Okay, I'm officially wincing now. So what should you do if, say, someone gets poked in the eye?
First and foremost, don't try to remove the object.
Right, that seems obvious.
Cover the injured eye, both eyes, actually, if the pain's really bad, and get to the ER.
Got it. And I'm guessing keep the head elevated.
You know it. Reduces swelling and pressure. Small detail, big difference.
Man, all this talk about eyes is making me want to go get mine checked.
I know, right? Okay, let's move on to something a little less delicate. How about face and nose injuries?
Ah, good old-fashioned brawls. So what's there to think about besides a bloody nose?
More than you'd think. The standards really emphasize that facial injuries can often come with head and spine trauma, too.
Oh, right. Force of the impact and all that.
Yep. Like the anatomy of the face means a blow can transfer to other structures.
So even if someone just seems like they have a busted nose, you can't rule out a concussion.
Exactly. Or worse, you just never know until you do a full neurological assessment.
Okay, that's good to know. What about knocked out teeth? Anything you can do to save those?
Funny you should ask. The standards recommend milk or saline solution.
Milk! Seriously?
Apparently, it helps keep the cells on the tooth root alive.
So it increases the chance of reimplanting it successfully.
You got it. Who knew milk could be so handy?
Not me. What about positioning for transport? Does it matter how they're sitting?
Big time. If they're conscious and there's no suspected spinal injury, semi-sitting and leaning forward is the way to go.
Why that position?
Helps drain blood and fluid and keeps the airway clear, which can be tricky with facial injuries.
Smart. Okay, we've done abdominal, eyes, face. I think it's time to tackle the big one. Head injuries.
You ready for this?
Bring it on. This is where it gets really
Oh,
interesting.
you said it, not me.
Head injuries.
Hmm.
Man, they're a whole other level of complexity.
No kidding. But the standards do a pretty good job of breaking it all down, even the different types of brain bleeds.
Oh, right. Like where the bleeding's actually happening?
Exactly. So you've got intracranial bleeds. Those happen between the brain and the skull.
Okay, I can picture that. And then what was the other one?
Intracerebral.
Yeah.
That's when the bleeding's happening within the brain tissue itself.
Oh, wow. So that's got to be way worse, right?
It's definitely more serious. Higher mortality rate because it's directly messing with brain function.
Makes sense. So how do paramedics even begin to figure out how bad a head injury is?
Well, they're trained to look for a lot of subtle clues, like fluid leaking from the ears or nose. Could be a skull fracture.
Oh, man, I never would have thought of that.
Right. And then there's bruising behind the ear, what they call mastoid bruising. That's another red flag.
So they're really looking all over, not just at the obvious bump on the head.
They're checking for raccoon eyes too, and any weird posturing or changes in behavior.
So it's like a whole body assessment, even though it's a head injury.
Pretty much. And here's something that might surprise you. Even concussions that seem mild, those still require transport.
Really? Why? Like if someone just bumps their head and seems okay.
Well, the thing is, symptoms can be delayed,
Oh, right. You don't always know right away.
and there's always a risk of long-term problems down the road.
Yeah, we're hearing a lot more about that these days, especially with concussions in sports.
Exactly. You just can't be too careful with the brain.
Okay, that makes sense. So what about the, like, worst case scenario?
You're talking about cerebral herniation?
That's the one. I know it's bad, but what is it exactly?
Basically, is when brain tissue gets pushed down through the opening at the base of the skull. Life-threatening stuff.
I can see why. So how do paramedics even handle that in the field?
Well, ventilation is key, but it gets tricky.
Trippy how?
Because how they ventilate actually changes depending on whether there are signs of herniation.
Oh, so it's not just one size fits all.
Nope. They use this thing called a capnograph to measure the carbon dioxide in the patient's breath.
Okay.
Normally, they're aiming for a specific range,
Yeah.
but if they suspect herniation, they'll actually hyperventilate the patient.
Wait, so they're making them breathe faster? I thought we were talking about avoiding that with chest injuries to manage pressure.
It does seem counterintuitive.
It does.
But the goal here is to lower carbon dioxide levels in the blood,
And why is that so important?
because that constricts the blood vessels in the brain.
Ah, so it helps lower the pressure in the skull.
Exactly. Buys them some time until they can get the patient to surgery.
Wow. Okay, that's pretty intense. I'm starting to see why paramedics need so much training.
Oh yeah, they have to be ready for anything. Speaking of which, let's move on to neck and back injuries. What are some things paramedics are looking for there?
Well, first off, any penetrating neck wound.
Yeah.
Automatic high alert.
Why is that?
Because think about what's in the neck. Major blood vessels, your airway. Even a small wound can be life-threatening.
Makes sense. So what do they do about it?
Control the bleeding, of course, but the technique is specific.
How so?
Pressure needs to be applied laterally, not directly over the airway.
Ah, so you don't accidentally block their breathing?
Exactly. It's a delicate balance. And then there's the whole assessment for neurological deficits.
Like weakness, numbness?
Those, yeah. But also things like changes in bladder and bowel function.
Wait, how are those connected to a neck or back injury?
It's all about the spinal cord. It carries the signals that control those functions.
So if the spinal cord is damaged,
Those signals get disrupted.
okay, so those seemingly unrelated symptoms could actually be a sign of a serious spinal cord injury.
Exactly. You got to think about the whole system.
And what about immobilization? Is it always a neck brace situation?
Not necessarily. It depends on the injury and the patient's symptoms. But even if they don't use a brace, they're still super careful to prevent any head movement.
Why is that so important? Seems like a small detail.
Trust me, it's not. Any movement of the head or neck could worsen a spinal injury. It's all about minimizing the risk of further damage.
It's amazing how much thought goes into every single thing they do.
Right. And it's not just about the physical stuff either. The standards also talk a lot about communication and patient care.
Oh, interesting. Like what?
Well, there's this guideline that says the attending paramedic should try to sit within the patient's view whenever possible.
I'm guessing there's a reason for that, right?
Yeah. Oh, yeah. It's to keep the patient from trying to turn their head. Could be dangerous if they have a neck or back injury.
So it's about anticipating their needs and preventing further harm, even in those little interactions.
Exactly. It's a holistic approach. And speaking of holistic, there's one more thing I wanted to touch on before we wrap up this part of our deep dive.
Okay, lay it on me. We've been talking a lot about the technical stuff, the life-saving skills.
Right, the rapid decisions they have to make.
But you're saying there's another side to all of this.
Well, it's something that's getting more and more attention in emergency medicine these days.
Okay, I'm intrigued. What is it?
The emotional and psychological impact of trauma.
Oh, right. It's easy to forget about that when you're focusing on the physical injuries.
Exactly. Think about it. Someone's just been through this incredibly stressful event, maybe a serious accident, a sudden injury.
Yeah, the shock alone would be overwhelming.
Exactly. So you've got the fear, the disorientation, maybe even some denial going on.
And that's all on top of the physical pain.
Right. So how do paramedics deal with that?
Yeah, what can they do in that kind of situation?
Well, the training is starting to shift to include recognizing those signs of emotional distress.
Okay, so basically being aware of how the patient's feeling.
More than just aware, it's about providing what they call psychological first aid.
So not therapy, but
Exactly. It's about offering reassurance, creating a safe space, letting the patient know they're not alone.
and maybe connecting them with resources for later on.
Right, like here's who you can talk to after this.
That's amazing. It really highlights how it's not just about fixing the physical problem, it's about the whole person.
100%. And it got me thinking about how we as bystanders, or even just informed citizens, how we can approach these situations too.
Yeah, with a little more understanding.
Compassion, empathy,
Yeah.
those go a long way.
This whole deep dive has been eye-opening. Paramedics do so much more than I ever realized.
Right, it's so much more than just lights and sirens. It's critical thinking, adaptability.
And a deep understanding of how the body works and how people react to trauma.
Exactly.
I feel like I have a whole new appreciation for what they do.
Me too. They're really out there making a difference every day.
So for all of our listeners who are feeling inspired by this, what's something they can do?
Never stop learning.
Ooh, I like that.
Take a first aid course, read up on common injuries, know what resources are available in your community.
Great advice. Knowledge is power.
Right, it is. And you never know when you might need it. Even if you're not a medical professional, just being willing to help can make a difference.
That's a great point. Well, I think that about wraps up our deep dive into the world of paramedics.
It's been a fascinating one for sure.
We've covered a lot of ground, from rapid assessments to the emotional side of trauma.
Hopefully everyone listening has a better understanding of what these amazing first responders do.
And maybe they're even feeling a little inspired to brush up on their own first aid skills.
You never know when that knowledge might come in handy.
True that. Until next time, everyone, stay curious, stay informed, and keep diving deep.
See you next time.